Hello. In last few months there have been lot of arguments, counter arguments, and sometimes fight over the healthcare reform. If we all understand how the healthcare industry and the insurance industry work, then maybe we will be able to appreciate and find out what is wrong and what we should be doing to fix it. So let me try to explain you how the healthcare industry and insurance industry works. Here in this diagram, these are the people, that is, we are the people, citizens of United States of America, these people. Here, we people pay the taxes to Uncle Sam, to the federal government. So there you go, you can see the arrow which shows that we the people are paying taxes to the federal government. Okay? Federal government collects money from us, and then federal government manages the Medicare and Medicaid program, and insurance company work with these Medicare and Medicaid program so that they can get the maximum money from these funds and try to serve the people. So this is what happens. The money goes from here, from the people, to the federal government, and from the federal government, this is the insurance company. So if you have signed for Medicare Advantage plan, then the federal government will pay to the insurance company here, you can see, and the insurance company, which is here, will work with the doctors and the hospitals and will pay the bills on behalf of the patient. But at the same time, here is the insurance company which makes a lot of profit, and these are the insurance industry executive, those who make millions and millions of dollars as profit, and they also have employed the lobbyists. These lobbyists, they take the money from the insurance company and give it back to the Congress. So that part of money, you can see that this money from insurance company goes back to the Congress. It is this money which is funding the Congress corrupt people, and they are arguing against then healthcare reform. It is this insurance executive who are fighting for the status quo with the help of these Congress people, because they are getting money from the lobbyist. In this bargain, who are the people, those who are suffering? It is we Americans people here who are suffering. Working for the welfare of the people, these are the few things which are very minimum we have to do. Number one, cover pre-existing issues and diseases. Number two, the insurance industry should not be able to drop the patient. Number three, we should be able to transport the insurance from one job to the other or from one state to the other. Number five, we should stop the high inflation that the insurance industry and the healthcare industry is imposing on the citizens. Number six, we should limit the frivolous lawsuit that the doctors and the hospitals are facing. Next, we should be able to import and buy the cheap medicine from anywhere that is possible. And next one is that even if by having this health care reform we have to borrow and we have to go in debt, this debt is good because this debt will help us for the future where the system will be just totally broken. Now, looking at the picture on a broader scale, let us see that American population can be divided into three categories. Category 1, seniors who are covered by Medicare and Medicaid insurance. Category 2, people who have health insurance through work or they have purchased themselves. And category 3, people who have no insurance of any kind. Now let's talk about category 1. If you are a senior and you have bought into one of the insurance program here, which is called Medicare Advantage or Medicare Plus, then what will happen is for each person, for each senior, the insurance company will get almost $10,000 minimum per year. And this money depends upon the county and the state that you live in. For example, for Dallas County in state of Texas, for each senior, the insurance company gets $800 per month. So that is $9,600 per year for each senior this insurance company gets. From this almost $10,000, the insurance company will pay to the doctors and to the hospital for the bills if the person falls sick. Whatever is left is their profit. And in most of the cases, the insurance company makes hell a lot of money in millions and billions, and that is the money that is at stake for insurance company, because you can see that for each senior the insurance company gets almost $10,000 every year, and it is a big money that is in their hand. The insurance industry executive, they are fighting for that. So if the insurance company after they have paid the hospital and doctor's bill at a negotiated price for the patient, the insurance company will have a lot of profit. The insurance executive make millions to pay in pay and bonuses by denying the claims and simply running it without much concern to the public, simply to make outrageous profit. It is this big profit that is at stake, and it is this profit that may be limited for them if there is a public option. Exactly the reason for opposition for healthcare reform. Now let's come to category 2, which is people, those who have insurance through work or they have bought into themselves. In that case, the insurance company will deny the pre-existing condition. The insurance company overcharges for certain category of people. Number 3, the insurance company drops coverage or play with the patient so that they do not have the cost when someone is sick. And fourth one is they raise the premium by price fixing with other companies. Now category 3 is people, those who have bought insurance, so God help them if you don't have insurance. There have been so much of talk about healthcare bill that this is natural to get confused. Before even we try to find what is there in the bill, let's see the basic facts and why the insurance industry is so much against any reform.